is to prevent a spread of microorganisms in hospitals, particularly the multi-drug resistant organisms, because this is very common. So I will address something like when you use endoscopes, for example, in hospital, you know, there is a lot of endoscopes, types of endoscopes. So, and you cannot have endoscopes for each patient. So we usually use frequently the same endoscopes for different patients. This is one example. You will face, for example, patient with Clostridium difficile. You remember the sporing bacteria. So you need to know if you're dealing with patient with Clostridium difficile infection with a pseudomembranous colitis, what precaution you should take. So even you should think from now that when I deal with organisms like sporing bacteria, the type of antiseptic or disinfectant will be different eventually. مش كده؟ يعني this is the way you should think. And I don't bother now what type of antiseptic or disinfectant, but this is a message. So you cannot have one antiseptic or disinfectant for all. You know, you have, so this is the way you think. So it depends if you're dealing with viral infections, noroviruses, if you're talking about prion infection, if you talk about TB infection. So the type of antiseptic or disinfectant you use in hospital is different. Even in the end of the block, when I talk about infection control, even the hand hygiene type different. The daily one we use is different than the surgical one for the hand hygiene itself. It should be different because you should know by now that almost all resistant bacteria or microorganisms transmitted in hospitals mainly by hand. So, and again, you should know as a basic that compliance of hand hygiene is very poor for clinicians. I mean, almost only 20–30% of the clinicians, unfortunately, they wash hand after they see patient or see a patient from one ward to another. In regard to nurses, it's much better. You talk about, say, 80% or probably 90% of the nurses, they usually wash hand before they do. So you should know that mainly, particularly gram-positive bacteria like staphylococci, for example, the way it transmits in hospital is by hand, mainly by hand. Right? There are other ways, but mainly by hand. If you talk about, say, gram-negative bacteria, on the other hand, mainly due to misuse of antibiotics. So when I go to hospital with MOH to inspect the hospital's infection there, if we see outbreaks, you know, outbreaks, something wrong in the hospitals, in relation to gram-positive bacteria, we always say that, well, you have a bad infection control. And if you see a lot of outbreaks in relation to gram-negative bacteria, we usually relate that to misuse of the antibiotics. I'm telling you that this information not in the textbook, but this information from the practice, what we see from outside. So you need actually to ensure the concept of sterilization, antiseptic, and disinfectant. Now, when you say sterilization, means remove all or none. You remove all the microorganisms, okay? It must be sterile. And do you know that any materials get into the body, whether it's equipment or injectable or whatever, it must be sterile. Now, sterility for injectable drugs, for example, sterility means free of all form of microorganisms, including the sporing bacteria. So there are ways to sterilize things. So any materials or equipments used in vascular site or inside the body, it must be sterile. One issue important to remember that when you talk about sterilization, particularly in injectable drugs or water for injection, sterility means free of microorganisms is not enough. What you should look for, do you think? Huh? Shatra, yeah. You should look to what you call it pyrogenic effect, right? Or we do pyrogenic test. Pyrogen test means free of the endotoxin, free of lipid A. So this is what we do. So you should know that most of the, because sometimes when you inject someone, patient, the injection itself, it may contain endotoxins, so it may induce fever. So sometimes fever in the patient may be not due to the infection, due to other things. So sterility basically is not only particular injectable drugs. It's not only free of microorganisms, including the spores, but it should be free of lipid A or endotoxin. Okay. Now, when you talk, including the spores, when you talk about disinfectant, means you minimize or you reduce the number of microorganisms. You don't remove all the organisms. And you may left over with what you call it sporing bacteria or difficult to get rid of the microorganisms. So the disinfection is actually killing or removing the microorganisms, right? And it could apply by chemical substances to achieve that. And I will mention a little bit. When you talk to antiseptic, both are the same, but antiseptic usually used for living tissues. Disinfectant may be used as for innate surfaces. So in the floor, in the bed, in the wall, and so on. So is non-living tissues. Now, putting in mind that when you talk about disinfectant, concentration is very important. So at one time, substance can be used same as disinfectant and antiseptic. Depends on what dilutions. Depends on the concentration itself, right? So since they've been used, I usually use this terminology together, but usually antiseptic used for living, disinfectant used for non-living. Okay. Now, before I go into the PowerPoint, sterilizations can be achieved mainly by different methods. One of the important methods, heat sterilization, right? Simple heat. So we have what you call it dry heat and the moist heat. Now you will hear from the PowerPoint a number of methods used for sterilization and for as an antiseptic or disinfectant. Now, based on the nature of the substances, based on the intention of using these substances, you will select the sterilization process. So in the exam, I'm not going to ask you list the number of chemical or list the sterilization process. No, I will give you an unknown and I tell you what do you think, how you sterilize these materials. So for example, and just an example, this is the way I need to think about it. Don't memorize without understanding. So if you have, for example, antibiotic or serum and you want to sterilize it, of course you cannot use heat. مش كده؟ You know, you're going to inactivate substance. So you need to think about other things. If you have cotton swabs, if you have something heat labile, you cannot use heat. You have to use other things. And vice versa, you know? So if you have liquid substances different than if you have solid and so on. So you need to think, you need to remember what the different methods used for sterilization and disinfectant or antiseptic. And based on that, you can select, depends on what the nature, what is the intent of using these substances, how I will sterilize it and so on. So sterilization means all and none, mainly by heat. So we have a dry heat and moist heat. Of course, from now, you should know what type of materials I can apply dry heat and what materials I can apply for moist heat. Now, dry heat is a hot oven, almost about, say, approximately once. I don't want you to memorize that, but approximately you talk about 150, 160 degrees centigrade for about half an hour or so. Usually, I don't want you to memorize temperatures of time. See, because this is, you would see it from the manual of the using this. But basically, I mean, if you talk about dry heat and you want to sterilize, means you have to heat it above 100. you know. So we talk about 150 or 160, sometimes 170. It depends on the guidelines used, either USP or British guidelines and so on. And usually we use it for 1 hour. Maybe in some textbook you say use it for 2 hours, right? And we usually use dry heat to something like materials can resist heat, particularly glass, for example, right? So we can use the dry heat. And there is an example in the PowerPoint. Now, on the other hand, moist heat, one of the important method of sterilization, because most of materials can resist moist heat, can stand moist heat. Usually moist heat, we divide it into three, either at 100 degrees centigrade, above 100, and below 100, right? The moist heat. Simple, I'm trying to simplify things. So if you talk about, say, at 100 degrees centigrade, you talk about boiling water, right? And in the old generations, where there is no disposable, where most of the people use glass syringes, for example, or glass petri dishes or whatever, because at that time there is no disposable petri dishes, for example, or disposable syringes. So we usually put it in the boiling water for about half an hour or an hour, but this method cannot get rid of all the microorganisms, can leave some of the spores, the bacteria. Right? But the most common method can get rid of all vegetative bacteria, including the sporing bacteria, is the heat above 100. We call it autoclave. So then remember the word autoclave, because you will use it a lot later on when we talk about infection control. So autoclave simply work as a heating under pressure. You know, cooking pressures at home, when you cook, مش كده ولا أنتوا don't cook at home? You cook at home or not? If you want to cook a chicken quickly كده for 5 minutes, مش you put it in a ولا لا? The same for autoclave in hospital. But in hospital, autoclaves is big rooms where you can put a lot of bulk equipment there to autoclave it or to clean it. Sometimes the blanket والsheets والكلام ده كله we use the autoclave in hospitals. So you're talking about 100 degree, over 100 degree. Usually you talk about 121 degrees centigrade for about 15 minutes, right? So 121 for 15 minutes. Sometimes in USB, they may increase the temperature a little bit, and if they increase the temperature, they reduce the time, because there is correlation between increasing the temperature and reducing the time itself. So this is the autoclave. Now, when it comes to below 100, we have two methods below 100. One called pasteurization, in all pasteurization, where we use it mainly for milk, most likely. These pasteurization, we use temperature less than 100, and there are two methods. We call it flash method, conventional method. You will have it in the PowerPoint. The concept of pasteurization, what is the concept? So when I do pasteurization, what my intention for that, to get rid of what? Pathogenic microorganisms, right? Such as, لا أوريس أنت كمان. Such as Brucella, مش كده? Such as TB, such as Salmonella typhi, Q fever, and so on. So the pathogenic bacteria usually associated with what? With materials like milk transmitted through the milk, our consumption, like Brucella. That's why we said if you pasteurize the milk or if you heat the milk, no one will get Brucella. If you heat the milk, no one gets TB. TB transmitted by milk. Brucella transmitted by milk. Salmonella typhi can transmitted by milk. So we use what you call it pasteurization method. Now there is another method under 100 degrees centigrade. We call it tyndallization. Someone called Tyndall, he discovered this. So what is tyndallization? Tenderization means I will heat the substance for 3 consecutive days, right, at 100 degrees centigrade. Do you know why I'm heating for 3 consecutive days? Think about it. So I heat the material at below 100, say at 70 or 80 for about half an hour. And then next day I heat it again. And then next day I heat it again. This is, we call it tenderization. So what is the concept behind that? Yeah. So when I heat for the first day, I will kill the vegetative, leaving what? Sporing bacteria. So when this material cool down, leave it for 24 hours, what will happen? The sporing bacteria will convert to vegetative. So I will heat it again. So I will kill the vegetative, and some of the spore is still left. So when I come to the third day, these spawning bacteria convert to vegetative, and then by the time I heat for the third time, it will kill all microorganisms, right? So this is the concept of what we call it tenderize. And usually we use it for sensitive material because it's less than 100 degree centigrade. So this is actually the heat, as I will discuss it here later on. Now, when I use autoclave, particularly in hospitals, I have to have indicators, right, to ensure that it works. So any materials, equipments in hospitals, you have to have an indicator. Even the hot oven, whatever you're using, we have to use an indicator. So usually in autoclave, to ensure that it's working fine, it kills the sporing bacteria. So we have different type of indicator. We have chemical indicator and biological indicator. Usually, what type of biological indicators? I'm using what? Resistant bacteria to heat, right? There are certain bacteria, Stenotromophilus, usually resistant to the heat. So we use what you call it chemical indicator and biological indicator. This is for the autoclave. Now, when you talk about chemical way of sterilization, we have two types. One called ethylene oxide. This is a little bit explosive, danger, but we still use it, ethylene oxide. And you have some information of ethylene oxide. And the other method, usually we use what you call glutaldehyde as 2%. And this is one of the chemical substances that can sterilize because it will kill vegetative bacteria as well as sporing bacteria. But if you want to ensure that it will kill sporing bacteria, I have to incubate whatever, something like endoscope in glutaldehyde for almost 6 hours or probably 9 hours, longer time to ensure that it will kill all the sporing bacteria. So this is a message for the sterilization. Now, we have also what you call it UV method of sterilization and ionizing sterilization. UV sterilization, the one you see in hospitals during surgical operations, UV, they have no power of penetration. So what they usually do, they actually remove the bacteria on the surfaces, which this is the one I need. So I use it usually during surgical procedures because I will minimize the number of bacteria during the operations. But unfortunately, it does not have the power of penetration into the tissues. So in this case, we use what you call it ionizing radiation, as I will mention later on. Last method of sterilization, we use a method called filtrations. So we use cellulose filters. These filters will, if you want to sterilize serum or antibiotics or heat labile substances, I use a filtration. And usually very small pores of the filter, almost 0.2 micrometer of the pore. This does not allow most of the microorganisms, But some virus may penetrate. Some mycoplasma, because it's very small, can penetrate. But for us, can be used as a method of sterilization because it can remove most of the gram-positive, gram-negative bacteria, most of the sporing bacteria, and we use it for as well heat-sensitive materials as a filtration. There are different type of filtrations, and I'm not going to go into details, but just as a concept of what method I should use if I want to sterilize heat susceptible or heat labile substances in a liquid form. So I use what you call it filtration. Now, other chemical substances can be used as disinfectant or antiseptic. Now, there is factors influence the effectiveness of any disinfectant and disinfectant. One of the important factors influence the activity, what it will be. What is the factors influence the effectiveness of antiseptic or disinfectant as a chemical substance like phenol, alcohol, chlorhexidine, and so on. So what were concentrations and temperatures? These concentration and depend. Now, generally speaking, before we sterilize any materials in hospitals or use antiseptic or disinfectant, we have to remove what you call it exudate, or we have to remove the leftover of the tissues or pus in the materials etc. in hospital. So we have to clean first, because if you don't remove these materials, most of the disinfectant and antiseptic will be inactivated, will interfere with activeness. It's the same for human. So if I have a dirty hand, for example, I cannot use directly antiseptic, right? Or whatever hand hygiene you're using in hospital. So what I should first use, I have to wash it. Logic, I have to wash it first and then I use whatever in hospitals. Otherwise, most of the antiseptics used in hospitals, the effectiveness will reduce in presence of these exudate or materials in the hand, particularly after surgical operation. So these are the factors influencing the antiseptic disinfectant. Now, at the end, we will go through what you call it, some material, they classified, there is someone called Spaulding Classification. This is Spaulding Classification. They classify the material into critical, semi-critical, and non-critical. So it depends on how to use it. So usually they say, if you're using a critical material, these materials get into the tissues, into the body, it must be sterilized. The semi-critical materials, the one in contact with mucous membrane or with some tissues in the body, we need to use what you call it high-level disinfectant, like glutathione, and I will give you examples. And the non-critical one, the one we use every day, actually can be in contact with contact skins, not being penetrating into the tissues. We can use simple antiseptic or disinfectant to get rid of these microorganisms. So when we go to the PowerPoint now, these are the concept or the definition I like you to hear about it. Can I?
Yeah.
I move it.
Sure. You want a PowerPoint?
Yeah. Please. Right. Now this is the definition of sports. Now I classify it to make it simple for you. I know it's a dry a little bit. It's not like microorganism and disease, but this basic information is important to know because I will use it later on when we come to infection control lectures in hospitals. So you talk about physical method or chemical method. You talk about heat, dry heat or moist heat. And then UV light, as I said, UV light have no capacity or to penetrate the tissues, so clean the surface. Different than ionizing radiations. And then we use what you call it filtration. So I'm trying to summarize it. And when you talk about chemicals, usually we talk about as a sterilizing agents, because chemical, I will use it as disinfectant, antiseptic. As a sterilizing agent, we use ethylene oxide and glutathione. Glutathione, when you go to the hospital, you will see glutathione everywhere, where nurse usually sterilized most of the materials, particularly endoscopes, with using 2% glutathione. So you will see these in hospitals every day. Now heat, you talk about moist heat. Heat, you talk about dry heat. As I said, you talk about temperature about 160 for 1 hour. Some textbook or some manuals can say 2 hours. It depends. Moist heat, something like autoclave. Either if we put at 121 degree, usually 15 minutes. If we increase a little bit the temperature, we'll probably reduce the time, right? Now, we don't want to memorize that, but they usually, in the old days, the 1 to 1 is equivalent to 15 pounds per square inch. So we usually memorize it when I was students, 15 for 15, 15 for 15. So 15 means 15 pounds per square inch, equivalent to 1 to 1 degree centigrade. So 15 for 15. This is I usually remember it years ago. Now, when you talk about dry heat, mechanism is simple, is by destroying the oxidative process, different than the moist heat. Moist heat usually denaturation of the protein, but dry heat usually related to oxidative process, and using either hot oven or using whatever oven as you see it in the lab. We use it with the metals, glassware, some waxes, some powders, some ointment, and so on. When you talk about moist heat, you talk about autoclave, and this is, as I said, under pressures. The advantage of the autoclave that they have what you call it latent heat, the one in red. So actually most of the material, when they contact with the surface of the material, the steam produced can be condensed, and usually there is what you call it latent heat. So latent heat is the condensation of the heat, and it can be keep for a long time. And as I said, 1 to 1 for 15 minutes. These can kill the spores, and this is important because this is can get rid of vegetative plus the sporing bacteria. And when you're monitoring, as I said, I don't want you to memorize everything, but simply if I want to test the efficacy of any equipments I use in the hospital, I have to use indicators. So we use here either chemical methods or we're using biological methods to ensure that is working in effective way to kill the microorganism. Then the pasteurization, the flash method or conventional method. Pasteurization, you don't kill all the microorganisms, right? So you kill only pathogenic microorganisms. And I remember because I work with the FDA, there was a problem in relation to pasteurization of milk or sterilization of milk. Pasteurization of milk, you cannot use it for more than 2-3 days. This is very important to know because you pasteurize, when we pasteurize the milk, still bacteria in the milk. I mean, but there are other bacteria still in the milk. So you need to keep it in the refrigerator. You need to ensure that you use it for only 2, maximum 3 days. But we only, by this method, we keep the nutritional value of the milk itself. But we get rid of the pathogenic bacteria. Some companies, they may use sterilized milk. In order for sterilized milk, you can keep it for longer, for a week or more, because you get rid of everything. But the problem with sterilized milk, you lose the nutritional value. So companies with the sterilized milk, what they do, they add vitamins, they add calcium, they add other substances to replace the nutritional value of the milk. But from the economic point of view, sterilized milk, you can keep it for longer time. Pasteurization can only keep it for a short time because it has also bacteria to it. So these are the most common microorganisms to ensure that pasteurization get rid of the typhoid, brucella, tuberculosis, and Q fever. Okay. Now, pasteurization, tenderization, as I said, someone called John Tyndall, exposure at 100 for 20 minutes for 3 consecutive days. And then the autoclaves. Now, other physical method, as I said, UV, these have limit of what penetration. However, it can kill certain local microorganisms. Particularly, we use it in the TB lab to clean or to reduce the number of bacteria. However, when we talk about ionizing radiation, and I'm sure you know that from basic knowledge in physics, we usually what you call it gamma radiation. Gamma radiation, not all hospitals have. I think King Faisal is the only hospital, I think, in the kingdom they have the gamma radiation. Is a very sophisticated installment to have what you call it gamma radiation because of the penetration capabilities of these of this method of sterilization. And then the filtration, as I said, you get rid of most microorganisms, but sometimes because of the small bacteria like mycoplasma, chlamydia, some viruses can pass through. However, our intention is to remove most of the vegetative bacteria and probably sporing bacteria. Filtration can fulfill the criteria to get the sterile material for that. Now, by chemical, as I said, either ethylene oxide or by glutaraldehyde as a 20%. And as I said, and this is now what you call it, basic information. So if you're talking about normal sterilizing equipments by glutaraldehyde, if there is no TB, no spores, you can incubate it 2% for about 1-2 hours. But if you think you want to get rid of TB or spores, you need to increase the time of exposure. This is a concept. And I don't want you to memorize 2 hours, 3 hours, 4 hours, but this is a concept of why sometimes they put the endoscopes for probably a few hours, sometimes for 6 or probably 9 hours to get rid of these microorganisms. Chemical substances, as I said, can be sterilizing, like glutaraldehyde, ethylene oxide, but we have a lot of chemical substances can be used as what you call it disinfectant and antiseptic, like alcohol, phenol, chlorhexidine, and so on. You know chlorhexidine? What do we use chlorhexidine? Huh? What? Where we use chlorhexidine? Do you know chlorhexidine? Most of the mouthwash contain chlorhexidine, مش كده؟ ولا لا؟ You use mouthwash ولا لا؟ ولا you don't? Anyway, chlorhexidine, usually we use it in the mouthwash. So there are several factors, as I mentioned, particularly using disinfectant and antiseptic. And this is, I know is not your job as a clinician, but this basic information you should be aware of. Because sometimes, particularly the cleaners in hospitals, they do big mistakes. Because if they clean the floor, for example, with disinfectant, what they do if they don't have enough disinfectant, they put water in it, and they may dilute it. If they dilute it, it will lose activity. So this basic information you should really be aware of. I know you are not going to do that, but at least even at home, when you use disinfectant to clean whatever, you should ensure what is the concentration. You cannot dilute it كده يعني hazard by addition of any amount of water. It should be used at certain concentration. So usually there's a proportion activity with the temperature as well as with the concentration. And then the time itself, the exposure time, you need to leave, particularly if you clean in hospital someone with Clostridium sporing, for example, you need to leave it for longer time. These are some examples of hospital disinfection method used. Like if you talk about floor and other, use like phenolic compounds in the skin, particularly if it's surgeon or for patient skin. You know, it's different now. If you're working as a surgeon, you need to use something like chlorhexidine and iodine with alcohol. But in the patient, you probably alcohol will be more than enough. So from now, you should know even applying the antiseptic for the skin different from one used in surgical and one used for the patient skin. Endoscopes, like I said, with formaldehyde, thermometers, and and so on, and so on. Now, these are basic information for microorganisms discussed. So you need to a little bit, eventually you will memorize that, because you know you should know what is the hardest type of microorganism to kill and what is the easiest one to kill. So it goes from Brian, the one caused mad cow disease, and then followed by spores, particularly Clostridium difficile. You will face it a lot in hospitals with the contamination, and then TB, and then non-enveloped viruses like norovirus, and fungi, and then vegetative bacteria, and then enveloped viruses. So these are, so based on the resistance of these microorganisms, I would select the method of antiseptic or disinfectant I use. Sterilization is different. Sterilization, you get rid of everything. But using the type of antiseptic disinfectant depends on what organisms you're dealing with. And this is this Spaulding classification. This is one they classified long time ago, about 40, 50 years ago. And they classify the surface based on the critical, based on the any objects that enter the sterile tissues or vascular system. Semi-critical, that one contact mucous membrane, or what you call it, non-intact skin, or non-critical one that can contact intact skin but not mucous membrane, and that case required low level disinfection. So from now, you should know for critical, you need to sterilize. For semi-critical material, you need to have high level disinfectant. For non-critical, you need to have low level disinfectant. Okay, and then this is again method of sterilization, as I mentioned before, including formaldehyde. We will discuss that in the lecture later on. And when you talk about semi-critical, something like different types of semi-critical devices in hospitals. And this is example. I don't want you to memorize this table, but this is just an example of what I mean by high-level disinfectant, particularly glutaraldehyde percentage. Just in the manual, you don't have to memorize it, but you need at least to remember some names of this. Hypochlorite, one of the, we use it a lot in hospital. Hydrogen peroxides, peracetic acid, we use it a lot, particularly with endospores. As in glutaraldehyde, in addition with other substances, we use it as high-level disinfectant. When you talk about non-critical one, as I said, these are the contact intact skin, but not mucous membrane. And just to show you examples of how many months some bacteria can survive on the surfaces. So if you work in hospitals, you're dealing with, for example, again, it's not to memorize, but just to give you an idea how important to think about this. So if you talk about something like MRSA, it stays for months on the surfaces. VRE, vancomycin-resistant Enterococci, Acinetobacter, one of the common organisms in hospitals, in the flora. Clostridium difficile for almost 5 months. norovirus, HIV, HPV, and HCV, and so on. So it gives you an example how important to ensure that you leave to ensure that you get rid of these microorganisms from the service in the hospital itself. And this is some of the disinfectant to use. And as you see here, the UD means this is manufacturing recommendation use dilution. So you look usually to the recommendation from the manufacturer. So you don't really memorize anything, but just to know that we have what you call it chlorine, bleach, phenolic compound, quaternary ammonia compound, and so on. Okay, this is the one I think. So any questions regarding this? So very basic, but just like to know the definition of each. When can you use that? What factors can influence this? Because usually in the exam, the question will come, you have something like X, what method you will use to sterilize or as a disinfectant or as an antiseptic. So at least you have the basic knowledge of how to deal with these materials. Okay? Huh. Any questions?
No, nothing online. You have 10 minutes.
10 minutes?
Yeah.
Okay. And I tried really to simplify the lectures in order to ensure that you get the message of what I mean by pasteurization, tenderization, moist heat, dry heat, what is a disinfectant, what factors, all basic knowledge, right? But you should know what is the hardest microorganism, part of microorganisms to deal with, what is the easy one, and then some of the chemical disinfectant used in hospitals. Like, any questions? Huh? Anyone ask for
nothing online?
Nothing online?
No.
Huh? Okay. Inshallah, on Monday, the exam, very easy. Don't worry about it. A lot of students came to the office worried about the exam. I select almost very easy questions. You know, we receive questions from all members, teach you in the blocks, pharmacology, immunology, and then I select two MCQs. So you have 2 MCQs for each lectures. So what I do, to be fair with the students, that I put list of the lectures, and then each lectures for each discipline, I have almost 2 MCQs. Okay, there's no short answer. Short answer will be in the final. OSBI will be in the final, inshallah. Okay. Thank you.
One question online.
Yes.
Yeah, she's asking if this is for another lecture. She's asking for the atypical bacteria. Do we have to study all the slides?
Atypical? Chlamydia, Mycoplasma, Legionella? No, it's just, if you remember what I said about chlamydia, see, for example, Mycoplasma, particular Mycoplasma pneumonia, basically, there is no cell wall in it, right? And it must be, because there is no cell wall, it grows as, there is no cell wall as a fried eggs, right? This is simply what you should know about mycoplasma. For chlamydia, you should know the life cycle, elementary bodies and the reticulate bodies, and the formation of inclusion bodies, because this inclusion bodies, we usually use it for diagnosis. And then you have 3 types of chlamydia: chlamydia pneumonia, chlamydia trachomatis, chlamydia setica. When I talk about chlamydia trachomatis, it causes trachoma, conjunctivitis, and other. These clinically, you will know it in the 3rd year. I don't want you to know this now, but at least you know there is a chlamydia pneumonia, chlamydia trachomatis, different serotype or serovirus, chlamydia setica. Legionella, mainly, it needs special requirement to grow the organisms, usually transmitted by water, by aerosols. So the concept here that sometimes patients get Legionella pneumophilia, sort of a pneumonia, and usually in ICU patient, we don't allow the patient to take shower, for example, or to be exposed to the aerosols. because these bacteria are found in the water itself. So this is all I need to know, you to know about in Mycoplasma, chlamydia, and the legionella. Huh? What else? Okay.
Yeah, right.
Huh? Any comments, questions? Okay. So we'll see you.